Good morning, practice members. Good afternoon, good evening, all of the above. Dr. Dave Acosta from your Wellness Center with a couple of tips for the low back. Too often people are having low back issues, so I wanted to give you just a few tips that you can use, share with your coworkers, share with your family on how to assess or how to improve the low back, okay? How to care for your low back. A couple of things, problems, let's start with that. Number one, if you are overweight, if you've got 10, 15, 20 pounds or more overweight, it's going to cause added stress on the discs and on the nerves of the low back. That's going to cause pain. So let's address that issue. If you need help with that, let us know. Number two is going to be sitting. Anytime I sit for more than 40 minutes, my low back gets a little tight and sore. So imagine if you're sitting for 6 or 8 hours a day. That's detrimental to your low back. So make sure you're taking micro breaks. Again, let us know. We would love to give you 2 to 3 really good micro break exercises. Number 3, weak muscles. If the stomach is weak, that's going to cause added stress in the low back. So we need to really strengthen the core, really honor the sit-ups, really get some stability in the core so that the low back has some help. So that's important. Now let's talk about some solutions, what we can do to help the low back. Number one, and most important, is the alignment. If the spine is out of alignment, it doesn't matter how much exercise or how much stretching you do, the bones are going to cause pressure on the nerves and on the discs, and that's going to be really detrimental to the spine. So let's address the alignment, and that's what we're here for. Number two is strength. Again, let's strengthen that core, let's strengthen the quads, the hamstrings, all of the muscles that are around the low back. We really need to recruit those and also help with low back strength, okay? Number 3 is going to be flexibility. Let us know if you need some help with some stretches, some yoga stretches. There's about 6 basic stretches that you can do for the low back, and we would love to teach you those and do them with you. Another thing is hydration. Make sure that you're drinking a lot of water. The muscles of the low back, the discs of the low back, the tendons and the ligaments all need hydration, and if they're dehydrated, they're more likely to rip, to break, to cause pain and injury. So stay hydrated. Half of your body weight in ounces of water. And then the last thing I want to mention is rest. Make sure you're getting plenty of rest. Get to bed at 9, 10 o'clock, 10:30 at the latest. And that way you're getting 6, 8 hours of sleep every night. The low back really needs to rest to replenish itself. The discs need to rest so that they can get more water so that in the morning you're ready to go. So I hope that helps you. We're here to help you. If you haven't been adjusted or checked in the last 2 weeks, you're overdue. 2 weeks should be the most you should go without getting checked because you're busy, you're driving, you're working, you're typing, you're doing housework, you're gardening. So make sure and get in and get checked. And it's going to be our pleasure to see you and your family. Have a healthy day.